Amendment 56, which is brought onto the ballot by the Food and Commercial Workers Union, Local Number 7, would put into the state constitution a requirement that companies with 20 or more employees provide health care for their employees. Then that health care, that health insurance, would be 80% for the primary employee and 70% for the dependents of that employee. Now, think about this. This is something that is a brand new requirement placed in the Constitution, and it is placed squarely across organizations, nonprofit organizations, with 20 or more employees, who heretofore have not had the resources to do that. It is something that will absolutely require a whole new look at the viability of some of these nonprofits, and some of the businesses. Small businesses are 50 or fewer employees, together with certainly the larger businesses. Now, the other thing this constitutional amendment would do is to create a super agency within Colorado state government, which would be an authority which would be doing health care for those employees who are not otherwise covered by their employer. So we have a whole new set of uncertain circumstances that now confront anyone who's trying to run a business or trying to run a nonprofit in this state. It's bad for Colorado, and it's bad for business. What the average small business is going to have to do, they're going to have to deal with a whole new set of very difficult choices. Let me give you an example. If I am mandated, if I am required by the state constitution to make payments for health insurance, 80% for my employee, 70% for my dependents, I only have so many assets, so many resources with which to work. Does that mean that I'm going to reduce someone's salary in order to offset the additional costs that the Constitution now requires me to pay? That whole menu of things that an employee would like to say, you know, should be a cost of living adjustment. There should be an increase in my salary because I've done a good job. Daycare provisions that may have been provided, opportunities for people to go to colleges and universities and have the employee pay for a portion of that tuition. That whole menu gets challenged because there's only so much in the name of resource to go around for that company. Well, the notion that this is just securing quality health care for employees, as the advocates would have you believe, is simply a ruse. It's a ruse, because what is going to happen is that once you put this in the Constitution, an employment opportunity for a company is going to be seriously challenged. People are not going to have the resources to do all the things that people need to have on their benefit package if they are constitutionally mandated to provide this kind of health care at this level. One of the other aspects that makes this so difficult is that the proponents have left up to the legislature, subsequent legislatures, areas of definition to look at how this program is going to work. Well, too many people who read a ballot measure as they get ready in the next several weeks to cast their vote in this November election, they're going to have to be faced with the fact that they don't even know all the facts and ramifications of how this would work, because subsequent legislatures are going to be required to make the definitional changes to make it work. That does nothing but add another layer of uncertainty to the operation of a company, the operation of a small business, or a nonprofit. We don't need uncertainty in these very uncertain times.